भएको आज सालै जिउ बात मारौँ कसरी
सानोमा सानो गएको बाछो धिरैमा राम राम सानोमा सानो गएको बाछो धिरैमा राम राम छोडेर जान सकिन मैले बरु मायासँगै छन् रेशम धिरिरी रेशम धिरिरी उडेर जङ्गी डाँडामा भन्छन् रेशम धिरिरी रेशम धिरिरी रेशम धिरिरी उडेर जङ्गी डाँडामा भन्छन् रेशम धिरिरी
There are some stark differences in health measures between Nepal and Canada. There are great differences in basic indicators such as infant mortality rates, the percentage of the population living under the international poverty line, and maternal mortality rates, as well as health measures such as percentage of underweight children and access to physicians. BABU works mostly in Kathmandu medical facilities, but also in rural capacities as well. We partner with several facilities throughout Kathmandu, including one of 2 pediatric hospitals in the country and several teaching institutions. BABU works with local establishments to develop innovative and effective projects. In 2010, BABU held 3 hygiene promotion programs in various schools in Kathmandu and reached over 100 children to teach the critical hand-washing skills that have been proven to decrease rates of diarrheal disease and respiratory infection among children. In addition to these public health promotion programs, BABU has worked with several health facilities to introduce improved infection control measures. This has included installing elbow-operated faucets in critical care wards and in improving access to soap and cleaned hand towels. Additionally, using a WHO hand rub formula, BABU has provided more than 20 hand sanitizer stations at critical points in hospital wards and critical care units. Along with these measures, BABU has introduced a poster program promoting hand washing at critical times during patient care among healthcare workers and parents. BABU has donated a variety of new and used equipment, including a dental chair to the dental department at the International Friendship Children's Hospital, as well as several neonatal CPAP machines and other much-needed ventilatory equipment and supplies. In the past several years, BABU has facilitated trips to Nepalese healthcare facilities for over 40 volunteers, including more than 20 University of Toronto medical and nursing students, as well as volunteers from Belgium, the UK, Holland, Germany, and the US. These practicums are designed not only to support the grassroots programs in Nepal, but to promote a deeper understanding of global health issues within the next generation of Canadian physicians. Volunteers are encouraged to develop independent projects with the organizations they work with in Nepal. For example, in summer of 2010, 3 U of T medical students visited the United Missions Hospital in rural Nepal and worked with local doctors. Here's a report from Dr. Sunil John on the work they did while at the facility.
Babies especially, but children in general, one of the most significant errors that you can make is giving them the wrong dose of medication. And so in the States, they've developed this color coding system so that basically everything, you weigh the baby or you get the baby's length, you get a color, and then everything is figured out based on that color. And so we wanted to do something like that here, but we couldn't use the system from the States because they don't deal with the same problems we deal with.
Yeah.
Malaria and Kala-Azar and typhoid are just not very common problems in the US. So we had to come up with our own system. And so what they did, I gave them a list of dosings and some references to look through, and so they made a reference.
This summer, 2 BABU volunteers performed a needs assessment of the physiotherapy programs at the International Friendship Children's Hospital and the Special Education Rehab Center. Through this, they have developed a rehab medicine exchange program that will work with volunteers from medicine, physiotherapy, occupational therapy, speech-language pathology, and special education specialists. BABU is currently working with partners in Europe to develop a European branch of BABU with the same vision of improving child healthcare and developing strong networks of healthcare professionals. This summer, several Belgian volunteers, along with the help of U of T students, created a mobile library system for the wards of the hospital, bringing more smiles to the faces of Nepali children and families. All BABU volunteers contribute to the hospital in individual ways, and in turn, they learn about the challenge and inspiration of working in healthcare in a developing country. BABU also works in capacity building in its partner facilities, including such things as hospital planning, equipment installation, and general maintenance in the hospital. BABU has also supported exchanges with Canadian respiratory therapists and professionals to share their knowledge. BABU has a big vision for the future, of spreading our work from urban areas to rural areas and providing relief. We also envision nutrition education and micronutrient provision programs for both clinical and rural populations. We would also like to expand our hand hygiene programs to reach more healthcare facilities and more children. We are continually developing our programs to provide the most beneficial and effective programs we can with the resources we have available. The health challenges that Nepal faces are complex, and they require a great investment from local stakeholders to make change. BABU believes that empowering these local initiatives and working alongside community groups to address these challenges is the best way to ensure sustained and concrete solutions. With your help, BABU will continue to build and strengthen programs that promote child health in Nepal.
你เป็นแม่โห